So the topic is porphyria. King George III of the British rule was suffering from porphyria. He was peeing red color urine and was having neuropsychiatric symptoms. So he was called as Mad King. And it is said that if King George III was not suffering from porphyria, the history would have been different in the American independence. In porphyria, the symptoms are neuropsychiatric symptoms. Neuropsychiatric symptoms. Then photosensitivity, which is cutaneous symptom. Photosensitivity. Then abdominal pain. The porphyria is classified as hepatic porphyria and erythropoietic porphyria. We will see the further subtypes. In hepatic porphyria, we have four: the acute intermittent porphyria, porphyria cutanea tarda, which is the most common. The porphyria cutanea tarda is the most common. Then we have hereditary coproporphyria, variegate porphyria, and there are different enzymes which are involved in those porphyrias. In acute intermittent porphyria, the enzyme defect is uroporphyrinogen 1 synthase. In porphyria cutanea tarda, which is the most common, the enzyme defect is uroporphyrinogen decarboxylase. Then in hereditary coproporphyria, the enzyme involved is coproporphyrinogen oxidase, and in variegate porphyria it is protoporphyrinogen oxidase. We have to memorize it. In erythropoietic type of porphyrias, there are two subtypes. The first one is congenital erythropoietic porphyria. The enzyme involved is uroporphyrinogen 3 co-synthase, and we will see further that what is the difference between the type 1 and type 3. We will see it further. The congenital erythropoietic porphyria, the enzyme defect is uroporphyrinogen 3 co-synthase, and in protoporphyria, the enzyme involved is ferrochelatase. So let us see what are the porphyrins. Porphyrins are the four pyrrole rings are involved. Four pyrrole rings form one porphyrin, and pyrrole ring is just like nitrogen, and it is a cyclic compound, and the nitrogen binds to the metallic ion, and depending upon metallic ion, when it is involved as ion, that is Fe, it is hemoglobin, that is heme, and in the plants, which is chlorophyll, the magnesium is involved. Chlorophyll. The the porphyrins are divided by Fischer's model. By the Fischer's model, let me change the color. Fischer's model into two types: type 1 compounds and type 3 compounds. In type 1 compounds, in the porphyrin compound at the 8th position, it is symmetrical, and in the type 3 compounds, the 8th position of the compound is asymmetrical. So that is the difference between type 1 compounds and type 3 compounds according to the Fischer's model. Porphyrins do have a role in cancer therapy. Let us discuss in very short. Role of porphyrins in cancer. As we have seen that porphyrins are photosensitive, The hematoporphyrin is injected. Hematoporphyrin, and when argon laser is introduced, the photosensitivity happens and it is cytotoxic. Thus, it has role in cancer. There is another type of porphyria which is toxic porphyria, which is toxic acquired porphyria. Toxic acquired porphyria, which is caused by heavy metals such as lead, or drugs such as grisopulvin, antifungal drug, or compounds such as hexachlorobenzene. So this can cause acquired toxic porphyrias. That's it. Thank you for watching.